You are watching the Doctalk show.
All right, so side effects definitely have a big role to play. They impact on someone's health. So likewise, it's important for a patient to report what they're feeling to either their health workers or to the person responsible, the one in charge of regulating the drugs, the NDA. So I want to find out from our NDA representative what system they have put in place to ensure they receive the feedback from the patients to know what side effects are occurring and what they can do. So, Ms. Victoria, how do you know that? How do you monitor side effects and how do you get feedback from patients?
Yeah, as a regulator, one of the key functions is to have a system to monitor all drug-related problems once we accept them on our market. So I mentioned that I work with the pharmacovigilance system. That system involves collecting information from the users, that is the patients, the doctors, and we've provided platforms that can be used to report all these, irrespective of whether it is a confirmed side effect or not, as long as we're not comfortable. If you've taken
if there's
a medicine,
any small effect they feel,
if you've taken a medicine and you get a reaction or you get an experience that you feel is probably related to that drug, we have several platforms. We have a WhatsApp, which is easy for anyone. Send in the WhatsApp, tell us, okay, I took this drug, I felt this after taking this drug, give us your contact so that we can follow back. You may not have all the information, but it's very important to emphasize that you go back to the person who gave you that drug, if it's a health worker, because they can assess you better. They have the objective evidence on whether that drug caused the event. That is something that I would emphasize. But doesn't stop you also from reporting to NDA. So apart from using our WhatsApp line, which I will, if I'm given an opportunity to read out.
Yeah, I think to be displayed on the screen.
Yes.
On the screen below.
Then we have the toll-free line. We have a toll-free line. You don't have to spend money. You just call and we respond to you, which is 0800 101 999. I repeat, 0800 101 999. And we have also a WhatsApp line, 0791 415 555. I repeat for the WhatsApp, 0791 415 555.
Those are the numbers of NDA. You've heard it from the expert herself. 0800 101 999 is a toll-free number. It means even if you have no airtime on your phone, you can still call this number and report your complaint directly to the National Drug Authority. Or if you're tech savvy like the .com generation, you can WhatsApp them directly on 0791 415555. So those are the numbers to respond to if you have complaints regarding drugs or possible side effects.
And then we also have our online platform. If you have access to internet, you go to the website, you can access the link. We have even the paper form, which you can download and fill in. So there are so many ways you can report to us, whichever is easier for you.
How about the person who is deep in Mudat district? No access to telephones, no access to internet. What should they do?
Unfortunately, all that we have, it's more of technology, the WhatsApp, the toll-free, the paper, but I think it's critical you as a patient to go to your health worker.
Go to the health worker.
Yes, the health worker, they send us, with our system, most of the reports we have are from health workers. So the health worker will capture this information and then they will send the information to us. But the beauty is when you send us, when you report to us, we can easily get back to you because we have your contact. Because if the health worker reports to us, we'll give feedback to him or her, and then somehow he has to give feedback to you. So there's maybe a lapse in the feedback, but yeah, still find a way of reporting that side effect.
Okay, so at least it's fairly clear that there is a system.
Yes.
And can either be with technology, for example, WhatsApp or the emails, or for those who cannot, who are not, cannot use the technology, they can go back to the health workers. Yes. But do you follow up on these health workers to ensure that they report the side effects to you?
Yes, we have a system, a campaign, programs for sensitizing the health worker. By the way, it's in our law regulation. It's mandatory for health worker to report the side effects. And we have quite a number of side effects that we've used actually to make decisions on drugs.
So this is all drugs across the board?
Yes, vaccines, herbal, you send whatever as long as you take it for treating your disease.
Excellent. So it's good to know the NDA has put in a reporting system to let us air out our concerns regarding the drugs in the market. I beg to ask, does this include herbal medicines?
Yes.
All kinds of medicines. All right. So, Ms. Regina, from a patient's perspective, what should the patient do? What are patients not doing that they should do? You know?
Yeah. Well, as Victoria was talking, I'm just thinking about this health worker who is in a rural hospital or whatever where he's working with so many people waiting in the line, you know, the workload. And I'm thinking how he juggles writing, you know, filling those forms. Yeah,
but I think somehow we would beat that system of overcrowding and overpopulation. But regarding the patient specifically,
yes. I was coming to that, but I'm just looking at the challenges because I know that there's a challenge as well in terms of those side effects reaching National Drug Authority.
Okay.
But I want to thank Vicky for highlighting that and letting the patients know so that the patients out there are able to report these side effects. And just again to urge the patients that please understand your medication as much as possible in terms of color, because sometimes you go and they've changed the medication, but as long as you know the name, many times you find people, even people who are educated, and you ask them, okay, they're taking hypertension medication, and say, what medications are you taking? And they don't know, and they'll say, hey, Musawo knows, Musawo yamanyi. You know, there's this tendency of putting everything in the hands of the doctor.
They should also be empowered. They should know their medications.
So I think we need to move away. It's changing, increasingly it is changing. So we should take the life into our hands, because it's us, it's the patient who knows how they feel. They're the ones, actually, the patient is the only constant in all the healthcare, you know, system, right from home, from, you know, transitioning in all the different healthcare, you know, system. He's the only constant. So he's a key stakeholder, and as such, all our efforts must focus on this patient. They need to be supported. They need to be provided with an environment that allows them to share their concerns, to be respected. And it's their right. Patients out there, it is your right to be respected. It is your right to seek second opinion if you're not satisfied. It's your right to know who is treating you, even to ask them if they have a license, you know, to operate. So we should take healthcare into our hands to avoid most of these unpreventable, just as Victoria said, 70 of these can be prevented, but we need to work as a system. We all need to work together, because it's like, just like in a system, if one part of the system is not there, then it will not work. It's all of us. We have the medicines, we have the health workers, we have the system itself, then we have the patients. It's like we all need to support each other so that we can have improved healthcare outcomes.
All right. So, and as we conclude, any final points, any those tips that patients should be aware of when it comes to managing side effects? Dr. Victoria.
Yeah, I think my last words, know your medicine, know all that you are taking, be watchful of any changes in your body once you take the medicine. If anything happens, go back to the person who gave you the medicine, discuss, report that side effect. But you can as well come to NDA, send a message, WhatsApp, call, and tell us about that side effect. We will come back to you. We will give you a feedback, whether that was a true side effect. We can refer you to a healthcare provider to assess you better. And with all this information, the overall aim of what we are doing as NDA is to ensure that the products that are used on the market are safe and efficacious and of good quality.
Yes, and hopefully we'll regulate the herbal products because they too have their own profile of side effects to deal with. Yes, so the main message here when it comes to drugs and side effects is all drugs, regardless of what they are, have side effects. They have the good effects, which are what the drugs are intended for, and they have the bad effects, which are sometimes they're unintended or we can't get away around them. So it is important for you to report these effects that you feel, these side effects that we're talking about. Some can be serious, some can be mild, some can be moderate, it all depends. But your responsibility back home is to report each and every effect that you feel, that you experience when you take a particular medicine. This will help the doctors decide which drugs are good for us, the people who are sick, which drugs are not good based on their side effect profile. And in addition, please avoid the habit of self-prescription. As you heard from the experts, you prescribe a drug for yourself without the knowledge of a doctor. You have no idea of what side effects the drug is going to cause, hence you have to endure the negative effects all by yourself, which is what we don't want. So I want you to live a healthy life, make sure you're free from side effects, and make sure you recover from the diseases. So I want to thank you very much, Mrs. Regina Kamoga, the chairman of the Patient Alliance.
Uganda Alliance of Patient Organizations.
Yes. So you're doing excellent work in advocating for patient rights and raising awareness, patients' awareness about drugs and their side effects. And Ms. Nambasa Victoria from the National Drug Authority for coming out strongly on the stance of NDA and drug regulation and side effects. So we will see you next time on the Doctalk Show, and thank you very much for listening. Our platforms are open, Facebook, Twitter, also YouTube. Feel free to subscribe and send in your comments questions on our social media platforms. We'll see you next time.